Our bodies grow scars to heal wounds. A urethral stricture is an internal scar that can be caused by traumatic injuries, previous surgeries, urinary tract infections, or even STDs. The scarring narrows the urethra, obstructing normal urine flow, and leads to complications such as a strong urge to urinate, frequent bathroom trips, weak or irregular urine flow, difficulty fully emptying the bladder, and even infections. Most men prefer minimally invasive surgical techniques, or MISTs, as the treatment for urethral strictures. One common procedure is balloon dilation, in which a deflated balloon is inserted and gradually inflated to stretch the narrowed area. Another method involves using progressively larger dilators to widen the stricture. Additionally, a urethrotomy employs a surgical knife to make an incision in the narrowed section of the urethra. Traditional treatments for urethral strictures, like dilation or cutting, can help for a while, but often the scar tissue comes back, creating what's called a stricture cycle. After the first treatment, about 80% of patients are doing well at 6 months, but after a third treatment, only 20% are still stricture-free. And by 2 years, none of those who had 3 treatments remain free of strictures. This shows that traditional methods tend to lose effectiveness over time, and many men feel trapped and revert to intermittent self-catheterization. This can significantly impact quality of life, like constant pain from urinary retention that interferes with daily activities. Additionally, patients may face increased frequency and need for retreatments, ultimately creating emotional challenges related to their condition. When less invasive treatments don't work, a more complex option called urethroplasty might be needed. This surgery involves removing the blocked section of the urethra, then taking tissue from the patient's cheek to create a graft and reconnecting the healthy ends. While it can be very effective, it is a major procedure that requires hospitalization, a catheter, and significant recovery time. Like any surgery, there are risks involved, and it often means time away from work and daily activities. A breakthrough treatment was developed to address the limitations of current anterior stricture solutions and disrupt the stricture cycle, known as the Optilume urethral drug-coated balloon. This minimally invasive outpatient procedure involves mechanical dilation by inserting a drug-coated balloon containing paclitaxel, which is key to its effectiveness. As the balloon expands for approximately 5 minutes, it releases a medication called paclitaxel. This medication is evenly delivered around the stricture area, helping to prevent new scar tissue from forming and reducing the chances of the stricture returning. After the treatment is complete, the balloon is carefully removed. At 5 years, clinical studies have shown that 72% of patients did not need another procedure after Optilume treatment. Additionally, patients experienced a 298% improvement in urine flow, from just over 5 milliliters per second to almost 20 milliliters per second, making everyday life much easier. Get back to living your life and break the stricture cycle with the Optilume urethral drug-coated balloon. Find a urologist near you offering Optilume for urethral strictures today.